The hallmark symptoms of ADHD are inattention, hyperactivity, and impulsivity. But almost all kids are inattentive, hyperactive, or impulsive at some point of time or the other. So then how do you know whether your child or someone you love actually has ADHD? In order to have a diagnosis of ADHD, these symptoms have to be present to such an extent that they significantly affect your life or your child's life in two or more situations. For example, in school or at home or in the playground. Inattention in children with ADHD may look like they're not listening when they are being spoken to, or like they're not following instructions at all. They may have trouble completing schoolwork or classwork or homework. Any of these may be difficult for them. They may have trouble getting organized. For example, getting ready for an outing or getting ready and packed for school may be really difficult for them. Children with ADHD get easily distracted and have trouble focusing. And yet there may be times when the kids are so focused on a particular activity or a task or a book that it's impossible to shift their attention from that task. This is called hyperfocus, and it's remarkably common in children and adults with ADHD. Hyperactivity in kids with ADHD may look like a child who's restless, fidgety, can't sit still, or in some instances has difficulty staying quiet in a situation where they're not supposed to talk. Impulsive behaviors may look like a child who finds it hard to wait for their turn in a game. This may also mean that kids with ADHD interrupt when other people are talking and don't wait for their turn to speak as well. As you can imagine, this makes it hard for children to get along with children with ADHD because they don't like kids who don't wait for their turn. ADHD is a childhood disorder. This means that most people will show the symptoms of ADHD before they're 12 years of age. But like all kids, kids with ADHD also change over time, and ADHD can persist until adulthood. Very often, we see a parent who gets diagnosed for the first time when their child is diagnosed with ADHD. Many times, adults with ADHD get diagnosed when their children get diagnosed with ADHD. This is because ADHD tends to run in families. If you have a parent with ADHD, it's much more likely that the child will have it too. We usually don't diagnose ADHD before 6 years of age because a lot of other things can masquerade as inattention, hyperactivity, and impulsivity when kids are really young. So usually it's diagnosed after the age of about 6. But some symptoms have to be present before the child is 12. Like all children, children with ADHD change over time. When they are younger, we might see symptoms of hyperactivity and impulsivity much more. But as they grow older, school-age kids and high school kids and adults show more of the symptoms of inattention. Children with ADHD have brains that are wired a little differently. Children with ADHD can't control their symptoms by just trying harder or just making an effort. It's not in their control, and therefore they're not to blame. The child with ADHD is neither lazy nor is giving you a hard time. In fact, they're having a hard time. Let's talk about school. Having ADHD can make school incredibly difficult for you. School requires attention, organizational skills, packing your bag, completing work, all of which is really difficult if you keep getting distracted and losing focus. Children with ADHD may have trouble getting organized, thinking ahead, and planning. In addition, many children with ADHD also have learning disabilities like dyslexia, which makes learning in school really hard for them. In the playground or in the lunchroom, since they have trouble waiting for their turn to speak or waiting for their turn in a game, it gets hard to get along with other kids in school. So this can make social life really difficult for children with ADHD. As for home, it can be really frustrating when a child with ADHD does not pick up after him or doesn't do his chores at home. So this can make relationships with family members like parents and siblings really challenging for them as well. When you speak to older children with ADHD and adults with ADHD, many of them see their ADHD as a gift. In fact, they don't believe that last D at all. They feel that their ADHD brings energy and passion into whatever they do. And if you remember, that area of hyperfocus that they have often makes them delve deep into whatever they are doing.